to everyone. Today's topic is about aggression management at DPRC. I am Sibi from Nursing Department. Management of a violent or aggressive patient plays an important role in healthcare setting. The main contents are introducing aggressive management in DPRC, introducing protecting patients against physical assault policy in DPRC, identifying the procedure and process steps in DPRC, references and questions. What is the definition of an assault? An assault, an unlawful threat or attempt to do bodily injury to another. The main purpose to protect patients from physical assault and particularly members of vulnerable groups. Scope are the process begins where an assault or suspected assault has been identified and covers incident management and learning the lessons of the event and implementing any changes. Protecting patient against physical assault policy. All managers, staff, patients and visitors must meet their responsibilities towards the prevention and management of aggression. DPRC will identify the high-risk areas of aggression and violence based on risk assessment. DPRC will adopt the following preventive measures in the identified high-risk areas, redesigning the waiting area and the physical layout in the centers to be friendlier and more comfortable when applicable. Implement customer services excellent standards to ensure high-quality hospitality with all patients. Comply with the customer happiness charter components aiming to satisfy and increase happiness of customers by addressing their needs in a timely manner. Ensure to equip DPRC with security staff and CCTV cameras. Protect vulnerable patients from abuse and assault. Ensure all staff comply with the DPRC Code of Conduct and Ethical Behavior. Security staff's regular rounds within the DPRC. Regular staff training on information security and about their role in identifying suspected visitors. All staff wear their badges during their working hours. Include the security staff and police officers in the aggression management plan. Conduct regular incident analysis and disseminate the findings to the concerned departments to avoid a similar reoccurrence. The physical intervention team is used as a last resort to safely control a physically acting out client until he regains control of his behavior. The team does not intervene in any situation that may pose a risk beyond their resources to intervene safely. Untrained individuals are not to participate directly as physical intervention team members but may function in a supportive role. The physical intervention team should be available during the operational hours. The responding team consists of a minimum of 4 staff. Most senior staff on duty, nurse, physician, security. In addition to customer service staff or social specialists when available. The team member should respond to the call for assistance immediately and consider it as a priority. The team member should be identified in each shift when applicable and the direct manager should allocate them regularly in the duty list. When applicable, the team leader can order chemical restraints to manage patient aggression. When there is a physical injury, the victim will be referred to the hospital for assessment and follow-up. If there is a legal complaint against the staff because of his or her involvement in the physical intervention procedure, the legal department should provide the legal support and advice to the staff. The police officer will conduct the necessary investigation if the incident needs police or legal further investigation. The physical intervention procedure will be activated when staff perceived themselves or others to be in danger of physical harm from an aggressive client. A client is acting out in a manner that is dangerous to self, others or the environment. there is an imminent risk of acting out. The situation is rapidly escalating out of control. Advanced physical intervention procedure will be activated when the aggressor has a weapon. To manage a potentially assaultive person, staff should be aware of personal items and clothing worn on duty, which may be used to cause harm to anyone in the area. Items such as stethoscopes, eyeglasses, watches, scissors, pens, lighters, and matches should be removed and secured in a safe place prior to approaching a problem person. Name pins, badges, earrings, necklaces, and chains should be out of sight or secured so that they cannot be used as weapons. Clothing should have no loose ties, collars, or edges that could be pulled by the problem person. If the problem person is a female, male staff may assist in her management, but there must be at least one female staff member present. Procedure and process steps. If the staff is unable to manage an assaultive person, he or she should inform his or her in charge. The responsibility goes to witnessing staff or the healthcare provider. Escalate and announce code white. If still unable to manage the assaultive person, with help from the security officer at the center, the nurse in charge shall notify the center director or deputy and instruct the informer to announce internally code white. Call the security office and the social worker or customer care staff and inform them about the code white. The responsibility goes to in charge personnel or security officer. Assess the situation if calling Dubai police is required. The director of the center, deputy, or most senior staff and the security in charge should assess the situation and, if requires, call Dubai police. Report incident. Assigned staff will submit an incident report through incident reporting form to the quality officer and support police investigation and reporting as required. References from Joint Commission International Accreditation Standards for Ambulatory Care 2021. Thank you.